There are a number of ways we can use a simple cane or a stick to continue to assist a patient who has impaired elevation at their shoulder joints. Okay? This following exercise will be done in the supine hook-lying position, and we'll show a number of different variations from active-assisted muscle training to glenohumeral joint capsular stretching. So here it goes. Patients in hook line to keep their lumbar spine in a good position, well supported with a pillow to keep their cervical spine in a good position. And I like to call this exercise thighs to eyes. So a patient is doing active assisted muscle strength training to again maintain the contractile properties of a muscle, and that's all active assisted motion will do. It'll help to maintain the contractile properties of a muscle. And this is movement, again, in the elastic region of a stress-strain curve where there's no significant stretching of the capsular structures. And now from this 90-degree position, I'm going to go back, and now we have a patient with a shortened glenohumeral joint capsule. Now we're in the plastic region of a stress-strain curve where we're getting a bit of joint capsular lengthening. Notice my hand position, and notice how I change my hand position. You can stretch different aspects of the capsule with this oscillatory stretch by changing the position of your hand. And you want to have the patient position their hand where they feel the most tugging and pulling, the most stretching sensation. One final thing. If you want to target more specifically the anterior-inferior aspect of the glenohumeral capsule, we now have the patient take an underneath grip with their impaired shoulder. Turn the cane a bit more into a vertical position and oscillate at the point of their end feel in this position. And again, more than one plane of elevation can be used. This is joint capsular self-stretching for impaired elevation due to a stiffness impairment.